Do you remember when Donald Trump said this?
What do you have to lose? You're living in poverty. Your schools are no good. You have no jobs. 58% of your youth is unemployed. What the hell do you have to lose?
8 years later, with this new tax bill, his own policies are giving us the answer. He said our schools were no good, but this bill makes it even harder for Black students to attend and succeed at HBCUs. And when they slash Medicaid, SNAP, and other programs that have been an important safety net for Black working families, it just drives more people into poverty. This bill is essentially a tax cut for billionaires, and it's going to hurt Americans across demographics and communities. Today, we're going to get into how it disproportionately affects Black communities by deepening financial inequality, cutting funding that supports HBCU students, and ultimately making the Black maternal health care crisis worse.
What the hell do you have to lose?
Thanks to Republicans and Mitch McConnell blocking every single attempt to raise it, the federal minimum wage hasn't gone up since 2009. That's 16 years without a raise for the lowest paid workers in America. And even with the same degrees and experience, Black employees on average are still paid less than their white counterparts. Why is there so much disparity in wages and employment for Black Americans? To help me make sense of all this, I spoke to Jasmine Burton, who is a Howard University Law School grad, comedian, and advocate.
The unemployment rate for Black workers is 7.2%. That's the highest it's been in nearly 4 years. That's double the unemployment rate for white workers and almost 3% higher than the national average. And the Black female unemployment rate was 4.9% in March, 6.3% in June, and 7.3% in July.
We've all seen the cost of living continue to rise. Rent, groceries, childcare. Yet this bill cuts the very programs that help families bridge the gap when their check just isn't enough. The money being cut from programs like Medicaid are what Donald Trump is using to hand massive tax breaks to billionaires.
He made $2.5 billion today, and he made $900 million. That's not bad.
Getting rid of these programs just erodes the safety nets that have been vital for Black families, while the wealthiest Americans continue to grow richer. None of this is good for the economy, and it's another example of Trump making promises he has no intention of keeping.
What the hell do you have to lose?
Under Donald Trump, Black Americans are losing more jobs, and students aspiring to attend HBCUs face less support and fewer opportunities for strong job prospects in the future. Without that support, many HBCUs may have to raise their tuition, cut faculty, or scale back programs, which shrinks the pipeline that produces 70% of Black doctors and dentists, 80% of Black judges, and 50% of Black teachers.
HBCUs strengthen the entire U.S. economy. They contribute billions to the national economy, create jobs, and produce highly skilled graduates in fields like medicine, education, engineering, business. Communities and local communities would actually decline, and entire regions would decline if HBCUs didn't exist.
And the damage doesn't stop with education. It's directly tied to the Black maternal health care crisis as well. Medicaid, which covers 2/3 of births for Black mothers, faces deep cuts. States that extended postpartum coverage to 12 months could lose federal support. Local clinics and community health programs that provide culturally competent care are defunded. And the result is that Black women, who are already 3 times more likely to die from pregnancy-related issues and causes, lose access to care that could save their lives. The tragic story of Shamani Gibson is a painful reminder and example of this.
Shamani Gibson gave birth to their second child, a baby boy named Kari.
She ended up with a C-section.
But that joyous moment quickly spiraling.
But when we got home, she was complaining about chest pain, she was complaining about shortness of breath. We had called the hospitals, and every time we did call, it was, just have a rest. If anything gets worse, give us a call back. We were disregarded until, she had sharp chest pains one day and couldn't make it up the steps.
The first thing I thought of was a pulmonary embolism. And so when she was sharing the symptoms, I was like, Shamani, it sounds like this. And she was like, no, Ma, they checked me in the hospital and they said that I was clear.
Shamani had less than 2 weeks at home with her child. But then the unthinkable happened. Shamani tragically suffering from a pulmonary embolism, a blood clot in her lungs, a condition that doesn't have to be deadly if discovered and treated properly.
Her death was preventable, but systemic failures in an underfunded healthcare system meant she wasn't taken seriously when she sought care. Shamani is not an exception. She is unfortunately a reflection of what's happening across the country. With so much on the line for the future of Black America, with healthcare, the economy, and our education, we have to show up for our communities and push back against these dangerous policies, because every cut to Pell Grants, Medicaid, and SNAP take more opportunities, more security, and more lives away from our communities. 8 years after this ridiculous question was asked,
What the hell do you have to lose?
the unfortunate answer is that we have already lost too much, and we're not willing to lose any more without a fight.